Hi, everyone. Welcome back to Annual Conference Live with 0 to 3. I'm Will Hallex. This is our fireside chat on working to end childhood abuse and neglect. I'm really pleased to be here with our two opening plenary speakers, Lori Poland, who's the Executive Director of EndCAN, that's the National Foundation to End Childhood Abuse and Neglect, and Dr. Richard Krugman, who's a distinguished professor at the University of Colorado School of Medicine, and Chairman of the Board of EndCAN. Thank you both very much for joining us.
Thanks for having us.
Lori, you have a very powerful personal account of surviving child abuse. Our digital audience wasn't able to hear the plenary, so would you mind sharing that here?
Yeah, so my background is at the age of 3, I was playing in my front yard, and a stranger drove up with his passenger car door open, asked if I liked candy, and I got in the vehicle. And then he took me up to the mountains and abused me both physically and sexually, and then dropped me in the pit of an outhouse toilet 15 feet below ground and left me there for 3.5 days, where I was found by bird watchers and reunited with my family. And then from there was taken to the Kemp Center a few weeks later, which was a treatment facility in Denver. And that's where I met Dick. And after many years, we reconnected, and here we are.
And these stories of child abuse and neglect can be very difficult to share, and so it can be hard to tell how prevalent it is. What does the research tell us?
You know, the unfortunate part about the field of child abuse and neglect is that there's not research. There's not enough research that can truly encapsulate the number of people who are abused and neglected. And that's one of the reasons why EndCAN exists. We want to increase that understanding and improve the field from a research perspective, preventative perspective, training and education, as well as advocacy.
Yeah, absolutely. And that seems like a great opportunity just to introduce EndCAN, what your focus is, and also talk a little bit about what the response has been.
Sure. Do you want to?
Well, EndCAN is, we're less than a year old. We formed our 501c3 in January of this past year. And we have focused on trying to raise awareness of this problem as a health, mental health, and public health issue, not just a social and legal issue. Lori and I visited lots of foundations. There's a place called the National Health Council in Washington, where 115 foundations that fund every organ of the research on every organ of the body, every adult and pediatric disease, and about 20 different genes, some of which cause very rare diseases, live. And everybody either thought there was such a thing already, and then realized there really wasn't. And so we're trying to fill a niche and trying to get this country to try to make progress in abuse and neglect the way we have literally obliterated many of the infectious diseases, acute lymphocytic leukemia, prematurity. All of these things have been enormously helped in my 50 years in pediatrics, and abuse and neglect is way, way behind.
And so looking at that more widespread perspective, how have you seen the approach to abuse and neglect change during your tenure?
Well, it's interesting. Back in the 60s and 70s, child welfare agencies in the community were mostly dealing with physical abuse and neglect. And they were doing okay. Their job was to work with families and say to the families, you know, we're pretty sure your child has been abused. We want to make sure that never happens again. We don't necessarily care who did it. We're not prosecuting you. We just want to help. And they were doing okay until the early 70s, when this country rediscovered sexual abuse as an issue. And while we have a huge tolerance for the physical abuse and neglect of children without calling the police and invoking criminal sanction, we have a zero tolerance for sexual abuse. And that, in the 80s, changed the entire child protection system from being helpful to being investigative, labeling, and it actually happened at the same time the mental health system in this country got completely filled with the chronically mentally ill after we deinstitutionalized them in 1980. And so the whole child protection system basically was reporting, identifying, labeling, but not helping. And that led to that's led to a big crisis. Now, interestingly, over the last 20 years, since 1996, physical abuse and sexual abuse has declined by over 50% in this country, but nobody has any idea why, because nobody collects the information or does the research.
And it seems sort of on that track that the work that EndCAN is doing, again, hearkening back to that gap in research, it seems to make it all the more important.
Absolutely.
We totally agree with you.
Yeah. And I think, so thinking about the professionals in our audience, the professional service providers, when they're working with children who have experienced child abuse or neglect or similar trauma, what should professionals keep in mind to best support them?
You know, I think that as a clinician myself, when we have empathy and compassion and have the ability to give children a voice and then also hear that voice, it can be really impactful. And the long-term effects of just that form of intervention can be life-changing for a child, especially a little one, and really having the ability to feel safe and secure with somebody. It doesn't even have to be a primary caregiver. It just needs to be somebody in their life that has that impact.
Absolutely. All right, well, thank you both for joining us. This is going to conclude our fireside chat, and I hope you'll join us tomorrow at 9 in the morning. We're going to be talking to Alicia Lieberman, who's an expert in early mental health and child development and one of our featured authors. So thank you very much for being with us.
Thank you.
Our pleasure.
All right, and
Thanks.
we'll see you soon.